Okay, we're broadcasting, and I'm going to go to Facebook. So give me just a second. It is preparing, so that's a good sign.
You do a lot of Zooms, Christine, or telehealth?
Yes, we certainly have started that. It's doesn't lend itself to OBGYN as well, I think, as some other specialties, but we're definitely doing it.
You know, GI, we're so history intense. I can do it a lot by telehealth, I would think.
Yeah, yeah, that's true.
You got to feel the belly, you know. Kind of,
Right. Listen to the heartbeat, check the blood pressure, you know.
Mm-hmm.
So, but it's helpful.
Taking a little bit longer. Not sure what's going on here. I'm going to have to reboot.
Yeah, we'll think nobody's there but us. You're kind of fooled knowing there's a lot of people watching.
Right. Seems like it's looping. Let me redo. Let's see what happens if I try to redo that. When in doubt,
Reboot.
Reboot. It says it's live streaming, but that, no, it's not. But we're not going to worry about that. We're just going to keep going. We're going to keep going. Let's see. I have about 1 minute to go. So if you're joining in, I see a few have joined the call. We'll get started in just a minute, and we're privileged today to have Dr. Marraccini. I think I pronounced that right today. I've been practicing.
Very good.
And our esteemed moderator, my friend, Dr. Chal Nunn. And so we're glad to have another chance to talk leadership in the midst of COVID. And so if you're joining us or you're wondering what today's all about, we're going to talk a little bit about what it's like in a medical practice in the middle of this. And we are also going to talk about what Dr. Marraccini, kind of how her leadership has risen to the occasion in the midst of this. You know, you can read about leadership, you can do leadership on a day-to-day, but then when something happens like this, it kind of heightens what happens and how you lead. So we'll do a deep dive into that. But officially welcome. And upcoming webinars, let's just talk a little bit about that. Next week, we have Wednesdays at 1 that the Lynchburg Regional Business Alliance does. And we're going to be back with Dr. Nunn. Chal is going to help moderate that one as well. We are privileged to talk to an ICU doctor and an ICU nurse from Centra about what it's really like on the front lines during this. And so that will be a great webinar. So tune in next Wednesday at 1. And then our next Lessons with Leaders is in 2 weeks on May 21st, 10 a.m. And we will be featuring Dr. Nancy Hubbard. She is the Dean of the Business School at University of Lynchburg, but her background is global strategy, acquisitions, crisis. So having led internationally, she's going to bring us a great perspective on, you know, how do you pivot? How do you do strategy and operations given what's going on now? So tune in on May 21st. We'll have all that registration details for you soon. And so now I'm going to turn it over to my friend Chal Nunn, who's going to tee up Dr. Marraccini. And we've got some prepared questions of things we thought you all might want to know. And then, as always, please feel free to start typing any questions you have in the chat feature. We'll remind you of that as we go through the morning. But for the next, 30 or so minutes, we'll have a dialogue and then go into some of your questions that you might want to know from Dr. Marraccini. So without further ado, Chal Nunn, take it away.
Okay, Christine Marraccini. I have two Christines.
I know.
Yeah, and it makes it a little more difficult. I look up and down, but you can't tell who I'm looking at. I'm looking at both of you now. So I know, Christine, we know each other well. We've been in Lynchburg a long time together as physicians. You know, OBGYN doctor here, and your medical group is Women's Health Services. Can you tell me a little bit about yourself, your training, where you're from, and how you ended up here, and sort of what your role is with your group now, your partnership?
Sure, sure. So I grew up in Silver Spring, Maryland, a suburb of DC, and I went to Virginia Tech undergrad, and then to University of Maryland for medical school, and I did my training then at Emory in Atlanta. So after my training in Atlanta, we essentially drew a 2-hour radius around Blacksburg because we wanted to get back to Virginia. We wanted to be driving distance to the football games. So then we looked at practices all around this area, and I was really most impressed with the practice here in Lynchburg and with the medical community, with the hospital system, with the public schools. So that's really what drew us here. And it's been a great fit for my family. We've been here 20 years now.
That's funny. I drew a circle for me too. My circle was Duke basketball. Had to
There
be
you go.
within a drive of Durham. So I limited it. So I'm 2.5 hours now. I'm right at the limit of my circle.
It's all about priorities.
That's right. All about priorities. I know last night you were on call and you were delivering babies. Give me an idea of how many babies your group delivers, of how many is done in town and how many your group does deliver babies.
So in Lynchburg, we have about 2,400 births a year, and that has been really surprisingly consistent for the past 20 years. Our group delivers about 1,800 of them, so about 75% of them.
Okay. Now let's get into the business part of this, now that we know who you are. You know, professional partnerships, particularly medical partnerships of sizes such as your group, struggle with governance and leadership and just really running the business. It is sort of the mentality that everyone is in charge. So recently you made some changes with governance and leadership in your group as part of the evolution. Can you tell us what you did and what you learned from that and how it's maybe prepared you for this crisis that we faced?
Sure. So our group has 11 physician partner owners. And as you know, physicians tend to be type A personalities and like to make decisions, which is great when you're in a medical crisis. You need people who can do that. But when you're trying to have 11 or 12 people all making decisions at the same time, it just really slows the process down. We were fortunate to have 5 of us who were really interested in how the business was running, and we were meeting on a regular basis. But even that slowed the process down. It was really hard to match up all of our schedules, and we had to wait weekly to make decisions. And so things just were not gaining momentum, and we were not getting things done the way we wanted. So we brought in a third-party consultant, that was you, Chal, and gave us some ideas about really what were some options for a better, more organized structure. So currently now I am the managing partner, and I work closely with our CEO, Monica Barker, to make the day-to-day decisions. And we can meet now, we meet daily, we meet twice a day, we meet throughout the day, and we can just move right along. I also have 2 other physicians that serve as my advisory board. And so the 3 of us can make more complicated decisions. We can brainstorm, come up with ideas. And then we then answer to our board of shareholders, which is the remainder of the physician owners, which allow them to really just focus on medicine and not have to be involved in the business of it, unless, of course, you know, we're doing a bad job, and then they can kick us out. But for now, it really has streamlined our decision processes, and we've been able to make them much more rapidly.
For you to evolve into this leadership role, you did some training and you had developed this over a number of years. This just didn't happen overnight, did it?
Well, that's true. I have been involved with the organization American Academy of Physician Leadership that provides courses both online and in person for the business aspect of medicine and leadership aspect of medicine. And over the past, really the first 10 years of my practice, I participated in those regularly. I obtained my certified physician executive certificate, which just is a milestone of courses that you reach in financing and finance leadership, et cetera. And it was all as it pertained to medicine. So it really helped to give me that extra education that we didn't receive at all in medical school. And so it really helped to be able to run a small business.
You know, I don't think any professional gets the kind of business training that they need to run their partnership. I was talking to a minister the other day and I said, did you ever in a minister training get anything about leadership of a church? And not, so there's always the problems arise just like with medical groups. Well, now that you've sort of helped us set the stage again, what specific things have you done in the practice for this pandemic? You know, because all of us are in families and mothers coming over to see you. And what specific things did you do to handle the crisis in the group?
So we have implemented several things. First, it was important for us to continue to see patients that had problems who needed to be seen. The last thing we wanted is for our patients to have to go to the emergency room. So we've stayed open half time to really support problems and support OB patients. We instituted a checklist of questions to try and identify high-risk patients, where they had traveled to, what symptoms they had, if they had any fever. That questionnaire goes out by our Vital Interaction by text and by email the day before the appointment. So our goal was to prevent any sick patients from coming to our office, because we're really a well office. Folks with respiratory symptoms are going to their primary care or to the urgent care centers. So our first goal was to prevent sick folks from coming and to then get them the care they need. The same set of questions are presented to the patient on arrival at our office. And if they do answer yes to any of them, we have a special pod, a special area in our office in which the patients go to, so that would limit any exposure if they did turn out to be positive. We have separated our providers. Our office, again, can support 10 providers. We have 5 different areas of 2 providers each. So we eliminated traffic between the pods. Once you get to your pod, you stay there. And so if there is an exposure in one of the pods, it's only limited to that physician and their support staff. We have our folks in billing and administration. We have moved them to their homes. So we had to set up IT for them, laptops, secure connections, so that they can continue to do their work. And those are just a few things that we've done in the office. Of course, the hospital setting, is a whole different set of things that we have done to keep our patients safe. In the hospital, we have an area limited just for patients that we suspect might have the infection, of which other patients don't have any exposure to. It's completely separate. So if you are delivering your baby, you can feel confident that if you come to Virginia Baptist, you're not going to be exposed to someone who may potentially have the infection.
I sit here and listen to you and think about how many things you have to think about, how complex it is for what we do, and it's amazing how you can think through all those things and pull them off. Now that we are sort of slowly reopening, are you going to do anything different? Or do you think you're going to stay the same? And how long will you stay the same? Or do you even know?
At this point, we are staying relatively the same, except that we are seeing more routine patients. So at this point, we're seeing anyone under 70 for routine problems. The over 70 population is still, somewhat needing to stay at home. We are, the other thing I didn't mention is masks. All of our staff is wearing masks. We are asking all of our patients to wear masks as well to protect our staff. So I think those things are not changing at this point. We're still, questioning folks. We're still wearing masks. We're doing deep cleaning twice a day of the pods. I don't foresee any of that changing, because the fact is, we know this virus is not going away. I mean, we know there's going to be ebbs and flows of this virus. And so we have to really maintain our vigilance in preventing infection and keeping our healthcare workers safe and keeping our patients safe, so that we can continue to care for patients and to serve their needs. People have needs. They need their birth control. They need to have their problems attended to. They need their babies cared for. We have to keep doing that, but we need to do it in a safe way. So we'll be continuing with these measures.
What have you learned about yourself as a leader in this crisis and your leadership style? Have you had to change anything? Did you have to kick it into a higher gear? Did you feel uneasy? How did you feel?
Well, I think what I learned is that when people are afraid, their professional behavior changes. I think fear can be manifested very often as anger and illogical behavior and decision making. So to try and get past that, to recognize the fear that not just our providers are feeling, but our staff is feeling, and to recognize it as fear and not as anger, and to be able to meet that, help them understand really what we know about the virus, what we don't know. There are measures we can do to put in place to keep ourselves safe, and we need to do that. But to try and, I really had to try to remove the emotion from the situation, because there's a lot of emotion in this crisis, and it makes people not think clearly. So I've tried to remove the emotion in myself and think logically about what are the steps that need to be put in place. You know, we are trained on evidence-based medicine, that we should be looking at the evidence and only implementing what seems to make sense. And the problem, that's sort of gone out the window a bit in this crisis. And some of it is because we don't have the evidence. You know, we don't have the trials that tell us exactly what makes a difference and what doesn't. So we don't have the evidence, but also we have the constant influx of news media that really stirs up the emotion. So I think I've really tried to look for reputable sources. I've tried to look to our public health departments, to the CDC, to, you know, what is happening in our community, how is it different from other communities, to be able to put in reasonable guidelines that make sense for our patients and for our practice.
Okay, so I'm hearing a little bit about emotions and uncertainty, and I'll come back to that a little bit later. You know, one other thing I don't think people realize about medical practices is, even though we are essential and still doing business, this significantly affected our financial situation in groups. And I'm sure it's affected yours too. I know my GI group, significantly affected. It's a little bit of a delay because of billing and stuff, but can you give me a rough idea of financially how it's affected the group and all that kind of thing?
So for us, our revenue is down about 2/3. So our business comes about 1/3 from obstetrics and delivering babies, about 1/3 from seeing well woman visits and problems in the office, and about 1/3 from doing surgeries. So our office visits and our surgeries have basically been cut out. So babies, fortunately, are still coming, so that's helpful. But for the most part, it's been, pretty devastating financially, because the bills keep coming.
Right.
Chal, I want to interrupt here real quick, because I've been on several calls about, and these are national calls from organizations that have had to pivot the way they're forecasting and budgeting. So how, you're now head of a practice, and so that on top of caring for patients and managing staff, how have you had to change your approach to managing the actual practice and the financial? Are you doing 90-day budgeting now? How are you flexing for that reality that you just talked about?
So we have done projections. We looked at dropping our revenue again down to 1/3 and keeping our expenses the same, and what that projection looks like through August. It's not pretty, but it's the reality of the situation. You know, as a small business owner, and I'm sure all the small business owners know that the owners get paid last. So everything else is the staff and gets paid first. And so it's very important that we accurately predict for my partners what can be expected, because everybody has commitments and personal bills to pay, and the emotional well-being of my partners is equally important. And so we've made some accurate predictions, and we have had some finances that, you know, we may have taken in bonuses that we are not taking, leaving the money in the company. We have some, of course, the PPP loan came in, which has been dramatically helpful for us. But basically, you know, we have to cut back financially, and we just have to do it. That's the reality. But I think being transparent with my partners was the most important thing, so people can plan.
It's good. Thank you.
That's really good. So you were eligible for some federal help. Just one program, is that what you got?
Correct.
Okay. Go ahead.
Well, I was just saying that, you know, it's been incredibly helpful to get that. The timing of it makes a difference. We're fortunate in our business that, again, because babies are still coming, we're still seeing patients, we're able to keep our staff working. It would be harder if we had to shut down. So that loan is working great for us. I'm not sure how it's working for other folks who do have to shut down, because you know, you do have to use it in the 8 weeks after which you've received it.
Right. If I was to ask you what the one real major challenge it's been for you with this, you may have already said it. It may be handling fear, but is there something else that's maybe the one major challenge you've had to overcome?
Well, I think, you know, looking back on this process, I think it's similar to someone going through the 5 stages of grief. Just like any sort of traumatic event, you know, we typically attribute the 5 stages of grief to when you've lost a loved one, but it can be really anything traumatic. And so the first stage is denial. You know, I was definitely in denial at the beginning. You know, this is not happening, it's not coming. I mean, I think the whole country was a little bit, you know, in denial. But then when it actually was here, you know, the next step is anger. You know, I was mad that elective surgeries were canceled. You know, I have patients who are bleeding. They have pelvic masses where, you know, it's probably not cancer, but it may be. So I have to tell the patient, look, you might have ovarian cancer, but I can't do your surgery for 2 months. You know, that's so hard for them and you know, for us. And so, you know, there was a lot of anger, and then there was a lot of, the next step is bargaining. You know, well, what can we do? Well, you know, what we need to do, some things, not the other. What makes ethical sense? I need to keep the patients safe and the staff safe, but I need to keep my practice in business, right? I mean, there's that, you know, if anyone tells you they haven't had this ethical dilemma in their head about patient safety, care, and finances, you know, they're probably not telling the truth, because it's really trying to weigh what makes most sense. And then the next step is depression. You know, before that PPP loan came in, you know, there was a few sleepless nights of, you know, oh my gosh, you know what, you know, I got kids going to college, and what's going to happen, you know? So I think that sort of depression stage happens, and then, you know, acceptance is really the last stage, where, okay, you know, this is here. What are we going to do? We're going to institute telemedicine. You know, we did it in a day. We put that program on every provider's computer. We taught the nurses, we taught the doctors. We started telemedicine in 1 day. You know, what else can we do remotely? We were doing some remote care within the hospital. You know, providers not wanting to go into the patient's room. So, well, let's talk to them through the door, on their cell phone. What can we set up from that standpoint? So, and let's start using our time to plan for the future. So what happens, this is not going to be forever. So let's put some things in place when the regulations lighten up. How can we see patients safely and continue our business in a safe manner? Let's go ahead and make those plans now. So I think moving through those stages quickly is the best thing, and what I needed to do is the sooner you can get to acceptance and moving on in this new environment, the better. I think, but those emotions happen, and we shouldn't judge ourselves or judge others if they are working through that process, but just getting to that acceptance phase as soon as possible for me was the biggest challenge, so that then we could then move on with new ideas.
What, you're talking about as you move through the stages of loss, how have you handled the depression other than making progress? You people, your frontline caregivers, the physicians, what have you done about your own mental health or being cooped up at home, or what have you been doing?
So I think it was important for me to keep my routine, to keep my same routine, even though we weren't seeing patients all day long. I was using that extra time to try and come up with new ideas. I run in the mornings, and I was fortunate that my friends still continue to run with me, even though they were sheltering at home, and I was probably their biggest exposure since I was still in healthcare. But, we ran 6 feet apart, and I think staying on that routine really helped me. And then just also using it as my kids have been home more, and using it as an opportunity to be with them and recognizing that there is a silver lining. So let's use it to do some family things together, and let's make the most of it, because we hope that this goes away and we'll all be back to our busy lives again. But so let's just take a minute and enjoy the fact that we have a whole weekend with no sports and no travel, anything, and let's spend some time together. So focusing on the positives, keeping my routine, and keeping exercising.
How's it going for the frontline caregivers? That you're at the hospital, you work with the folks on the front lines. You never know what's going to come in the door, and you may have a COVID patient, all that kind of stuff. How are folks dealing with that, the frontline people? Because, we've been in this business a long time, and we've given of ourselves a night call and putting ourselves at risk to take care of people. Now, this is a little bit more than usual, taking care of people. It really puts us at risk. What are you seeing? What are you hearing?
So it definitely is stressful. This is nothing like I've ever experienced in my 20 years. I've never before felt like I was personally at risk of getting sick or potentially getting a fatal illness. I had a needle stick once a long time ago, but it's a similar feeling, but it's contained. This is it can happen anytime, anywhere. You don't know who's positive, who's not, so it's that constant fear, and it's really hard for the staff. Now, fortunately, you'll talk with Dr. Hardison next week, and they are certainly the front lines. Fortunately, we've not had anything like what they've seen with our OB patients. We've just had a few under suspicion, but still, nurses are afraid. I had one nurse who she didn't drink or eat or go to the bathroom for her full 9-hour shift, because she just couldn't fathom taking off her mask and taking off her gloves, and surely there'd be some virus that would slip in somewhere, and you just can't work in that environment. So again, we're just trying to have drills. So we've had drills about how to care for patients in this environment, how to do emergencies with a suspected COVID positive patient, so people can start to feel comfortable with it. They can realize, okay, I can do this. I can take care of patients without getting sick. So trying to work through that process has been helpful, but it's certainly something that we've never seen before.
Yeah. we've got a question that's in line with the next one I was going to ask you. How do you think it's going to change the way we practice medicine in the future? I mean, I've always said never waste a crisis. We're building this bridge to a new future.
Yeah.
What do you see on the other side? You know, just, it's very early, but what are we creating that's going to be better, do you think?
So I think there are some things that are going to be better. First of all, the telemedicine aspect of it. It doesn't lend itself as well to OBGYN just because we need to hear the baby's heartbeat, we need to check a blood pressure, we need to do an exam, but there's a lot but we can do by telemedicine, and I think that's a huge plus. I think organizationally we're having telemeetings, you know, so just
Like now.
I think, yeah, like now. So that's a great thing, because in the past we've had to schedule meetings around everyone physically being present, and now that doesn't have to happen at all. So I think we can be able to problem solve quicker, get things done quicker. I think we have seen telemedicine within the hospital, you know, talking to patients on an iPad inside the room because we're outside can easily translate to care from our ICU colleagues down the street at Lynchburg General. You know, as you know, we have a separation between Virginia Baptist and Lynchburg General, and sometimes we have sick patients at the Baptist. And so we would love to have an ICU doctor at the bedside at Virginia Baptist. And with the telemedicine now, we can do that. And I think that will happen, and that will continue to make things better.
You know, the other thing I've seen happen is generally it takes forever to get paid or some new payment for some new procedure we do from Medicare or other insurance companies. But with this crisis, CMS has said, oh, do telemedicine, we'll pay you full. They didn't used to do that. It used to take a year to get that approval, and now it's like that. So the crisis has helped move things along. Have you seen that? Do you agree with that statement?
Yes, I definitely, and that's been a huge help, because we haven't also been as fearful about, you know, certain legalities about the situation. Some of that has been lifted as well.
Right.
You know, we can't, you know, if we don't protect our communication so much, you know, then we just won't do it. But we've been able to do the telemedicine without some of those stipulations. So that's been good. I think another interesting piece that we really have to look at hard as healthcare providers is what is essential and non-essential care. And meaning, are we billing and doing stuff that the patients don't need? Because if all of a sudden it goes away, you know, what do they need? What do they not need? And what should be paid for it, and what not should. And so, you know, just with our OB patients, they typically stay in the hospital 2 days after a vaginal birth. But we've been trying to get folks out of the hospital to maintain resources. We've been sending folks home day one. And there certainly is a population of patients that benefit from going home early. Now, some don't, but some do. So really looking at that critically, who needs to be into the hospital and who doesn't, I think that is something that is here to stay.
Right. Well, you know what I say. I think we overdo everything in healthcare. Overdiagnose and overtreat. And it's driven by a lot of things. You know, what we've been discussing maybe reflect on something I've read recently about how to do crisis communication. And I think I've heard from you, the way you've been talking to your group and your staff sort of resonates with that. And there's 6 principles. The first one is don't over reassure. You know, sometimes straight talk will calm people rather than agitate people. I think if we don't straight talk, the people will get agitated. And people can smell a rat. They can smell when it's not truthful. So I think that what we've seen is a lot of happy talk if we watch too much television. And we need to have reality talk. And we as physicians have always done that. We don't give happy talk. We give straight talk. So would you agree with that?
Yes, I would definitely agree. And so you have to be transparent with what is happening, or else they won't believe anything that you're saying. And trust is a big part of, alleviating the fear. And, some fear is good because that motivates you to do things. But too much fear can paralyze you. So you need sort of that happy medium of let's look at this as a real thing. We're going to meet it with real decisions and changes in a logical way.
Right. And I think we also need to proclaim uncertainty.
Yes.
With so much about this we don't know, whether you get immune from having it or not, how long that lasts. Is it going to last all year, 2 years? Is it going to be a fall wave? We just don't know. There are models, but the models are just possibilities. And I think we need to acknowledge diversity of opinion with that. So that's number 2.
And I think that maintains your credibility, because as I got up in front of my staff to tell them we would be closing the office to a half day, this is the plan for next week, but that's it.
Right.
Next week, it may be completely different than right now, and, not making any promises for the future that you can't keep.
Mm-hmm. Number 3 is validate emotions, which is what you talked about. There's fear. You have fear. I have fear. Everybody listening to this has fear. And there's misery out there. You're tired of being cooped up. You want to get your hair cut. I actually had my wife trim me a little because I knew I was going to be on this today. And, thank goodness I got it cut right before all this happened. But so validate your emotions. And you shared that in the fear and what you talked about. And number 4, give people things to do. And you did that. You've done that with telehealth and new projects, and you got the loan, and you're able to keep your employees there. You're putting on special projects and special things you've never had done.
Right.
All right. So, and then number 5, admit and apologize for errors. Yeah. I'm sure we all make mistakes as go along.
Yeah.
And number 6, share dilemmas. So you talk openly about what your big decision is going to be next and next and next, and talk about those kinds of things.
Yes.
Okay.
Yes, that is true.
Christine, you wanted to bring up something about Carillion?
Well, we were talking before we got on the call, and I was just curious, Carillion, there was a lot on the news about how if you were in the NICU or your baby was in the NICU, you were not going to be able to stay. And so I was just curious, and I asked you kind of what the procedure is for Lynchburg. And if you wouldn't mind sharing that, because I think it's interesting. It does depend based on the hospital and what the infrastructure is like at the hospital. So if you want to talk just a little bit about that, and then we do have a question in the chat that we'll go to after you answer that.
Sure. So yes, so the policy at Centra is still that we are maintaining one support person with the patient throughout their hospital stay, delivery, and after. If their baby needs to go to the NICU, we do have parenting rooms that patients can stay for an extended period of time, kind of like in a hotel, for as long as their baby can be there. And it's dependent on how many patients and parents are there. But it's a great option because moms they don't want to be separated from their babies. They need to be physically and emotionally close.
Yeah, it's tough. It's tough. Okay, so we've had a question in the chat, which I think is worded beautifully. What are some of the positive outcomes that you have seen from this troubling time? We know that not all things are negative from tough circumstances. What have you seen that could attribute to a beautiful change within your personal life and your practice?
So that's a great question. Well, I would say definitely in my personal life, it's a focus on family. I have 4 kids. My oldest daughter was working in DC for a consulting firm. She's now working remotely from my home, which she's not that happy about, but I think it's wonderful. Our weekends were always, our weeks and weekends were always, we were at lacrosse games, we were at swim meets, we were at different things. Every weekend was something. And we never had a weekend just for us. And so when everything just abruptly halted, it was like, holy smokes, we can actually have dinner together. We can have some conversations. We played some games, we made Yakis, we did, stuff. So that has been a great silver lining, and also reflecting on really what are we doing for our kids, being so overscheduled into all of these activities. Really, like, is that long term? What is more important for them to develop family bonds that they will have with their families, or that they're good at travel soccer? I think that's a big question that we have to really look at. And then professionally, I think the good things are that, again, some of the new ideas with the IT infrastructure, with telemedicine, I think is a good thing. I think critically looking at what is necessary in healthcare and what is unnecessary, and that can maybe go a long way to addressing the costs.
Yeah, that's good. That's good. Yeah, you talk about the family situation. So many parents I've seen on social media talking about, wow, the tyranny of the should, right? We should have them doing all these things, but yet what's creating those memories and those traditions is what they're able to do right now. If you take advantage of that, if you turn what's negative into something positive. So it's good. Any other questions? Y'all feel free to post some questions in the chat.
They know how to do the chat. Do they all have the feature at the bottom? They just click on chat.
They all have the feature.
Okay.
They all have that feature. So I'm happy to entertain any more questions.
I got a few more. You got some.
Okay.
You want me to go ahead?
Go ahead.
Christine, we've been in this medical community for a long time. And what are the strengths you see we have here in Lynchburg, in Centra, in a larger community that helps make us work well during a crisis like this, which I think we are? Can you give us some strengths and perhaps some of our weaknesses as a community?
So I think certainly the strengths are the willingness of physicians to work together. Because it's a small community, we socialize with the doctors and nurses. We go to the same pool. We go to the same schools. We see each other in and out of both the personal and the professional environment. And I think that just goes a long way to making bonds that, when it's time to work together, it makes it easier, and it's very respectful, and you're looking out for the other person, and it's really a community effort. And that is one of the things that drew me to Lynchburg, 20 years ago, really high caliber healthcare. And it keeps me here for sure, the bonds with my partners and the rest of the community.
Yeah, that was something I've noticed too, the collegiality. I've been to a lot of medical communities, and we have a unique collegiality that a lot of places don't have. We communicate well, we trust each other, we work well together.
Yes, that's for sure.
Okay.
Christine, you talked about your training, like you've had this formal training that you went to in executive leadership once you kind of headed down that path of leading a practice. Can you talk a little bit about maybe something that you read or that you learned but never really had to exercise, and now you're like, wow, or conversely, nobody taught me about that, but intuitively I've had to bring that leadership quality to the forefront?
I think there, as you have this business in front of you, wherein you're trying to figure out which direction it needs to go, there's lots of options in medicine, and I think you need to be true to yourself and to your core, and trying to there's a balance between finances and what kind of care you want to provide for patients, and really always staying focused on what your core ethics are, I think is important. And also just, first of all, defining that for yourself, defining that for your group is important. And then you can really have a guiding light for decision making. So that's something I hadn't really thought about. Certainly in medical school, it's all just about taking care of the patient. But then when you're kind of thrown out in this world to do whatever you have to see really what kind of practice you want to be.
Yeah, and that transcends medicine, right? It is identifying your own personal core values, your organizational core values, and how are we going to adhere to those when something may not align with that. So I think we talk about that a lot in Leadership Lynchburg and in our programs is what are your core values, and then what are your organizational missional core values. So that's
right.
good.
And so, for example, with this crisis, they're deciding what patients needed or could be seen, or what surgeries needed or could be done, and going back to the core of we're here to provide good healthcare for our patients and to keep our patients safe. And, in the end, that has to trump the finances. And so, making those decisions, you really have to figure out where you're coming from so that you can make the right decision.
Yeah. We've had another question come up on chat, and this will probably be our last one unless someone wants to submit a quick question. As the governor lifts restrictions, how do you propose facing staff fears?
So I think that acknowledging the fears is very important, and maintaining the things we have put in place, not to, we can't just get relaxed and say, you know what, it didn't come here, everything's fine. I mean, of course, we have had cases here, but New York didn't happen here, so we're going to be okay. We cannot take that approach. We need to remain vigilant in screening our patients, in having the cleaning that we're doing, and wearing the mask, and abiding by the CDC guidelines, and remaining some sort of, we can still see patients in smaller pods and remaining somewhat isolated. So I think maintaining all of those things till we can really see how this virus is going to act throughout the year and next year.
Yeah.
And then if there is another one in the future, we'll be able to.
She froze.
She froze. She's finishing her thought, which is good. Yeah. It's good that it's 10:45 and we were ending. We'll get through.
There you are.
There you are.
Am I back? Okay.
You're back. I've said it's good that you were finishing your thought and that it's 10:45. So if it's not like you were in the middle of the 4-point presentation of birthing. Yeah.
Good.
Yeah. Well,
my answer to that, let me just chime in. I think giving people the right things to do, the best we know what to do right now. Each one will make their own choice, but I want to give you the best possibilities I can give you, because I think it's going to be with us for a while. We're going to reopen schools. We're going to reopen daycare. We're going to reopen our practices. We're going to reopen. We're going to have to do that, but we've got to continue to mitigate.
Yeah.
And we got to continue to test. We got to continue to trace. And we have to do our best public health, even though we're not really experts at that right now. But we will learn. So next week will be different. The week after that will be different. The week after that will be different.
Yeah. And Chal, one of your 6 points for the crisis was, admitting what you don't know. It wasn't worded that way, but we don't know. The truth is we can't say that next year we'll be back to what we did in 2019, right? We just don't know. And so that fluidity and that ability to be nimble in the midst of this, amidst the fear and amidst the stress and dealing with those stages of grief, right? Because the way we enjoy life is different right now. And so Dr. Marraccini, thank you for staying up, I should say, since you worked all night.
Thank you.
Staying up with us and sharing a little of your wisdom. We wish you the best with your practice. Stay well. And
too.
for those on the call, reminder, next Wednesday, Chal will be back. We have an interview with an ICU doctor and nurse. And then on May 21st, our next Lessons with Leaders, we will be interviewing the Dean of the Business School at University of Lynchburg, Nancy Hubbard. It's gonna be fascinating to hear her global experience, some perspectives she has, not just on crisis management, but also the future of education. Because I've been on a lot of calls about what this is doing to colleges. So tune in for that. Chal, thank you for again joining us, and Dr. Marraccini, thank you, and we'll talk soon, everyone. Stay well.
Great.
Thank
Thank
you.
you.
Thanks, Christine.
See ya.